Hello, everyone. Thank you, Tom, for having me here. Hello, Jennifer and Ladina. Thank you for moderating. I'm Xiaomin from China. I'm working in Hangzhou Red Cross Hospital. Thank you for allowing me to pre-record my speech because of the time difference. Here's my city Hangzhou, locating on the east coast of China, a city with 2,200 years of history. Hangzhou covers an area of 16.8 thousand square kilometers, which is pretty close to half Belgium. It has about 10 million population. Hangzhou Red Cross Hospital, also named Zhejiang Province TCM and Western Medicine Hospital. Hangzhou Chest Hospital, affiliated to the Medical College of Zhejiang University, is a general hospital specializing in tuberculosis. Formerly known as the French Catholic Hospital, founded by a nun in 1928 as the Charity Hospital. It has 10,000 beds, 1,700 staff, 42 clinical departments. Right now, I'm the vice manager of the hospital, and I'm in charge of the IT department. I used to be a clinical engineer in Hangzhou TCM Hospital. It's quite challenging to be a clinical engineer in here because people in certain managing positions may face job switch between CE, IT department, purchasing department, the pharmacy, or even switch between hospitals, just like me. The challenge lies in personal career sustainability and learning new knowledge. It is good and always great fun to keep learning. People can be more adaptable and have a variety of skills and wider horizons. I tried to keep up with the innovation in CE and IT and relevant technologies. I went to the first and third ICE HTMC Congress. I've been the interpreter in a couple of presentations made by English speakers from different countries, including Miss Jennifer Jackson back in 2017. Those are probably the brief introduction of myself. Here's my IT team. Although IT and CE have a lot in common, IT systems are required to be highly robust. It is more like a cannot stop for a second infrastructure for a hospital. Today I'm going to talk about what IT can do to support the hospital, especially clinical engineer. Information systems have become an important part of a hospital's business process. The integration of the information systems with other vertical and horizontal health system elements is part of the roadmap of National Health Information System development. Information infrastructure of my hospital comes like this. Based on business layer, data is collected from interfaces of lists, PACS, EMR, pharmacy, and finance systems, then sent to applications for clinical use and analysis. There are actually hundreds of information systems in my hospital, which connect together somehow and exchange data with each other. Some patient data is also shared between hospitals and health insurance bureau. Each year, a lot of investment is made to perfect and update the systems. Let's have a look at a couple of cases. Nurses scan the IV barcode to check patient ID. Data will be sent to central station. In emergency management system, data is collected from triage procedure, vital sign monitors, system clock. It helps and improves healthcare quality control. Doctors, nurses, and patients sign on pads for EMR. Clinical pathway provides guidance for the standardized treatment of the disease, and clinical pathway mark can be seen from the patient overview screen. Knowledge database estimates various information of patients to prevent human errors and logical errors such as diagnosis, gender, age, allergy history, and healthcare activities such as prescription and contraindications. CDR is the core component of hospital information platform based on electronic medical record. With the friendly interface, it promotes efficiency of clinical workflow. One of the most important things of doctors is antimicrobial management, from drug purchasing, prescription to consuming. Each procedure related to antimicrobial is collected and monitored. According to the rules preset by the pharmacist, warning message will pop out for doctors to double-check the need of antimicrobial using. Anesthesia information management system is a good case of IoT, which enables operation arrangement, operation type maintenance, monitoring, etc. Through data collection, the overview and relevant statistical analysis can be realized in the business intelligence system. In Central Sterile Supply Department, a tracing system supports each workflow of medical instrument disinfection to improve efficiency and patient safety. Implants used in the OR and angiography are traced as well. Cloud imaging service allows patients to scan the QR code on the report to watch or download images without printing them. We also provide staff an online library for their reference. Information systems ensure the hospital running in accordance with the rules and regulations, secure data transmission and healthcare safety, help decision-making, and IT support CE in many aspects. There has been a lot of knowledge exchange between China and other countries in recent years. One of the hottest topics is CE-IT integration. For example, in Cedars-Sinai Health System, couple of EKG cards, fetal monitors, infusion pumps, and patient monitors were networked 5 years ago. Device number up to more than 2,000 pieces. In Mid-Yorkshire Hospital of UK, infusion pump transducers were installed to track their work status and location for real-time asset management, saving capital cost. Cleveland Clinic introduced the benefits and complications of a connected world and concern about data protection. In Brigham and Women's Hospital in the U.S., more than 1,600 pieces of medical equipment were integrated. In my hospital, we have several device integration systems, but there's more requirement from hospital managers, healthcare quality control, and finance system department. The amount of data we are able to provide is far behind the need. So, one of the challenges we CE and IT are both facing is how to find medical device integration solution for a particular hospital and at the same time avoid cyber risk. Clinical engineering definitely need more support from IT. Medical insurance payment reform requires lean management of medical devices. What equipment should we invest? Which kind of consumables and IVD to use? In some hospitals in China, CE department do health technology assessment to support decision-making for hospital managers. They analyze use of ventilators and find out they don't need to buy new ones because only half of the machines are in use at the same time. To decide whether or not to use barbed sutures during certain procedures, CEs study partial nephrectomy cases from the EMR and compare key index with international database such as warm ischemia time, operation time, estimated blood loss, post-operative complications, length of stay, post-operative renal function decrease. With evidence-based methodology, data from science and technology literature database and from hospital EMR is extracted for analysis based on a structured EMR. With the help from information technology, CE can be more prepared for the challenges. Information systems provide benefits in many other ways. Drivers may pay for parking after leaving the hospital. Car plate is scanned and data connected to big data system of the government. As a hospital with more than 4,000 outpatient visits each day, this can be pretty welcome. In the canteen, RFID implanted plates are popular, bring convenience and save manpower. Managers watch business intelligence dashboard to understand hospital operation data. And hundreds of approval processes are running in our system. This is what we are doing. I'm proud to be one of them. And thank you for listening.